Hello, my name is David Kaplan, and I am a physician specialized in anesthesiology and pain management. In addition, I have had a long-standing interest in Eastern philosophies and martial arts, with more than 40 years of studying and teaching the Japanese art of Ki Aikido with mind and body coordinated, and Chinese Kung Fu. Throughout my medical training and more than 20 years of practice, I have endeavored to integrate these philosophies in a holistic approach to my patients. Oh, and I am also a classically trained violinist. Stephanie has been a music educator in public and private schools for 32 years in the areas of choral, orchestral, general, and band music, and has served on the faculty of the Bullis School for the past 22 years. She has also been practicing Chinese martial arts for over 15 years. Together, we provide health and wellness services through our organization, Wudong Wellness Incorporated. What is the Wudong in Wudong Wellness? Wudongshan is located in central China in Hubei province and is known as the birthplace of Tai Chi. It is a UNESCO World Heritage Site with 9 temples and palaces amidst a vast mountain range. For centuries, wellness practices have been cultivated in these mountains. Our wellness training derives from Wudongshan, China, and we have traveled back and forth from the U.S. to China to learn this system in order to bring it to musicians here in the United States. Our master is Shifu Yuan Shigong, and we also have permission to study with his Kung Fu brothers, Master Zhang Shuchao, also known as Master Bing, and Master Zhou Xuanyun, known as Mysterious Cloud. Wudong Wellness is founded on the idea of integrating Eastern medical traditions from Wudongshan, China, in a way that supports sound Western medical principles. Our specific martial lineage, the Wudong Sanfeng Pai of central China, is more than 800 years old, and we are part of the first generation of Westerners allowed to teach this tradition outside of China. You may see Stephanie listed in this presentation as Meimao Xiang. This is a name given to her by Master Yuan Shigong at her discipleship ceremony in 2012, and it means plum blossom, magnificence, excellent, energy, sun, light. You may also notice the white socks worn by the disciples of the Sanfeng Pai. These socks represent the clouds in the mountains because Sanfeng Pai disciples are known as cloud walkers.
We hope that our lengthy introduction helps give some personal context to the title of our presentation, The Tao of Musculoskeletal Wellness. So let's begin with the word Tao, literally translated as the way, the path, or the method. This definition implies that the Tao is a kind of journey, as in Taoist immortal Lao Tzu's words, a journey of 1,000 miles begins with one step. Unfortunately, this translation of this passage does not accurately represent Lao Tzu's meaning. The meaning is that the journey of 1,000 miles begins under your feet or while stopped. The Tao is about naturalness, balance, reflection, awareness, and embodying your body, or rather a doing of non-doing. It is not living from the neck up. There is nothing to transcend or create. It is the revealing of a condition which can only be revealed while stopped in reflection, and for us here specifically, the revealing of the condition of musician health. So now let's move forward in awareness together.
Workshop precautions. Please seek and follow through on the advice of your physician. Do not discontinue taking prescribed medications unless instructed to do so by your physician. Please see your physician before starting any new exercise protocol. Please do not perform any movements in the workshop that would exacerbate a previous injury, cause you an injury, or provoke a medical emergency. And finally, if you feel pain, stop. As an aside, all student musicians who have been taught and are using these methods have been assessed by a complete physical by a licensed United States physician at the beginning of every school year, and musicians with potential injuries are referred to physicians for treatment.
First, let's take a moment to ask ourselves what the essential question is in assessing musician health. As a music educator, we want to continue to discover more about our musculoskeletal health and that of our students, and to ask ourselves how that evaluation and assessment might impact teaching, pedagogy, and repertoire choices. To discover more about the health of your music students, we will use the process in medicine. We will remember this by the word HEAT with a double T. It is history, examination, assessment, testing, and treatment plan or disposition. This is all followed up by a reevaluation after the treatment plan has been in place. In clinical health settings, physicians use intake information forms to find out health histories about patients. For musicians outside of a clinical setting, we might be able to take our cue from the Ackerman and Driscoll intake information form, which they put out in 2010. This can be found at the ResearchGate internet location that is on the screen. Take a moment to capture that with your cell phone. I would add to this that you should be careful as you collect any health information. Make sure that it's relevant outside of a clinical situation, and also that you are careful with information collected because it might be subject to privacy laws in your country. In certain music education settings, an evaluation of handspan might be useful. A tool that I have found valuable is from the Hand und Instrument publication by Christopher Wagner from 2005. It includes hand measurement guides with both male and female and child percentiles for spans between fingers, etc. Among the recommendations that he makes in the book, he does say that working off of the instrument can be helpful, and also that the handspan between the middle finger and the pinky finger tend to be the most informative about where injury might occur.
Another examination that teachers or students could do to assess risk of PRMDs is a simple joint laxity test, shown here. Assessing the level of hand activity and peak force a musician experiences on a regular basis is an important evaluative tool for maintaining musculoskeletal health. Bernard has created hand activity and peak force 10-point scales that music students and teachers can use to determine if excessive hand activity or peak force may impact musculoskeletal health in a negative way. By comparing the intersection of hand activity and peak force on this graph, music students and teachers can determine if music activity consistently occurs in a safe and healthy range, or if the threshold limit value of peak force and hand activity indicate unsafe levels of musculoskeletal use. Notice that as peak force increases, hand activity must decrease in order to remain under the threshold limit value or safe activity range. A practical way to evaluate music student hand activity is to make hand activity assessment a normal part of music score analysis. By making a record of peak force found in loud dynamic levels in music and by assessing the hand activity required in fast tempos or rhythms, it is possible to paint a picture of the overall threshold value limit of a piece of music by examining each measure. When students are young, evaluating threshold value limits in a piece of music is something music educators can do to ensure student musculoskeletal health. The practice of examining threshold limit values could also become a normal part of music score analysis for students as they mature. Developed over time, this practice may help educated musicians make informed decisions about healthy and balanced music repertoire choices in light of their current musculoskeletal concerns. The following demonstration is a series of self-evaluation tests that student musicians can use to assess their musculoskeletal health, injury, and pain in an effort to identify health concerns and avoid health complications. Before engaging in any movement self-assessment, a licensed physician should be consulted. If you feel pain during this self-evaluation, please stop the movement. A licensed medical professional should be consulted if you experience pain or injury. Painful arc test. Lift your arms to the sides, and as you raise them, turn your palms upwards until they touch over your head. Take a moment to self-reflect on whether you had pain or a decrease in your range of motion. Apley's scratch test number 1 for flexibility and range of motion. Reach your hand behind your head and slide your middle finger down your spine as far as possible. Again, note any pain or decreased range of motion. Lift-off test of the subscapularis muscle. Put the back of your hand on your lower back. While maintaining this position, attempt to raise the back of your hand horizontally away from your body with the forearm parallel to the ground. If you experience pain, please stop. Apley's scratch test number 2. Continue to put the back of your hand on your lower back and then slide the back of your wrist as far up your spine as possible. Note any pain or decreased range of motion. Job's test of the supraspinatus muscle. Lift your arm to the front and rotate your arm inwards. Then use the other hand to lightly press down on the outstretched arm. Assess whether or not you feel pain or weakness. Infraspinatus muscle test. Keep your elbow at your side and bend the lower half of your arm in front of you to 90 degrees, with your palm facing inward. Then, while keeping your elbow at your waist, externally rotate the lower half of your arm outwards to the side. Phelan's test for carpal tunnel syndrome. Place your arms low in front of you, then rotate your arms inward and lift them to a 90-degree angle. Reverse Phelan's test. Place your palms together as if in prayer and hold that position for 5 minutes. Tunnel sign for the median and ulnar nerves. To test for tingling or pain in the median and ulnar dermatomes, take your index and middle finger and lightly tap on the inside of the wrist. Do the same on the medial side of the elbow. Flick test for nerve assessment. Shake your hands vigorously and assess whether you feel pain or tingling in your hands or arms. Stretch to aid thoracic outlet syndrome. Lift your right arm to the side of the body, then tilt your head away from the arm.
Part of developing a training plan for your students means using functional conditioning, which results in supercompensation or improved peak performance over time. Remember that the deeper the fatigue curve, the longer it will take for your students to recover from that particular training session. This is an example of a 12-week musician performance training plan, which we use at Bullis School and was developed by Dr. Bestep Gray. Whether my students are in a developmental week, a breakthrough week, or a recovery week will depend on what the plan is for that particular week. For example, in a developmental week, they'll have 2 challenging practice days, which alternate with 70% intensity practice days, with 1 day of unloading. Dr. Bestep Gray of Peabody Conservatory and the Johns Hopkins Medical School has also developed a daily music rehearsal training plan. Here is represented the preparatory phase of stabilization of the weeks of 4 through 6. And here's an example of what my students at Bullis School would do in a rehearsal cycle of 1 hour or 2 hours during the preparatory stage of weeks 4 through 6.
So, what considerations might you make in choosing an exercise or flexibility program for you or your students? You might want to remember the word FIT with 2 T's: frequency, intensity, time, and type. Relevant factors to consider include your student's age, health status, schedule, and environment. These will be influential in dictating the frequency, intensity, time, and type of intervention selected for either a warm-up or an intervention performed outside the practice session or rehearsal. As you begin to work with music students on a musculoskeletal health exercise intervention, it is important to evaluate the perceived exercise exertion experienced by the students. In 1982, Borg published the scale exhibited here to measure perceived exertion during exercise. This scale is one way to evaluate the student exercise interventions you use within your classroom or private studio.
We now would like to take a moment to introduce to you some integrated and non-integrated rehearsal practice musician exercise, stretching, and massage systems with some additional recommended literature shown on this slide. On this slide, you can see non-integrated and integrated exercise interventions. By non-integrated, I mean that they occur outside of the music rehearsal, and integrated happen within the music rehearsal. If you take a closer look, you'll see that I've included the page numbers for where you can find the exact intervention with instructions and/or pictures.
Another consideration in selecting a health intervention for your students is how research supports the chosen movements of a certain exercise program. In this example, you can see how the movement of the Wudang Qigong exercise, called the snake, utilizes nerve sliding techniques beneficial for the maximum amount of excursion of the median nerve.
For your safety, please move to a space that is free from obstructions. Before we begin, let's take a moment to think about our posture. Are our hips nice and relaxed? Is our chin up, and is our crown going up to the ceiling? Clasp your hands together and rotate. Try going the other direction. It may seem more difficult. Shake it out. Now the elbows. Nice big circles. And the other way. Big circles from the shoulder. And the other way. Now, arms in different directions. This may be difficult at first, but it's helping your brain to coordinate the different sides of your body. It's also putting blood into your fingertips, which could be helpful as you are playing your instrument or using the computer. And now the waist. Nice slow movement. Notice if you have any tension in your lower back. Now the other way. Now for the knees. Going above and below the kneecaps, find those spots that are a little bit tender and rub them. Now down and up. If this is difficult for you, listen to your body and do only what you think you can do. Circle the knees if you can, inward, now outward. And shake out your legs. Now, put your right leg in front, make it bent, and the left leg straight, and stretch. Keep your body lifted up as you're doing it. Switch sides, left in front, and right leg straight. Keep your body upright and feel that stretch. Now, to the side, lean into that right leg. And now, lean into the left leg. And shake out the legs. Put the left leg behind and cross it underneath and just sit for a moment. And up. And right leg behind, cross them and sit. Feet together, body relaxed, bend the knees and step out to the left. Raise the palms. Inhale. Arms go down. Exhale. Now to the sides. Inhale. Flex the palms. Inhale while twisting the palms upward, and hold the breath. And exhale, bring the hands down. Inhale, palms go up. Exhale, palms go down. Inhale. Exhale. Last time, inhale. Exhale. Flip the palms to point downward. Inhale. Exhale. Inhale, bring the palms up. Exhale. Last time, inhale. Exhale. Collect the chi that you have used. Make the hand position for your meditation. Bring the chi to your lower dantian, which is 2 inches below the navel and inside the body. The dragon is a water animal and is associated with the kidneys. Hands raise, inhale, hands down, exhale. And curve the arms as if you're holding a ball. Pull in the left leg and step out. Left arm goes straight with palm up. Right arm up by your ear and flexed. As you're twisting, hold your breath. Then exhale. Now left arm is over the right, holding a ball of chi. Allow your heart rate and your breathing to calm. And when you're ready, bring in the right foot. Step out, right hand out straight, left hand up by your ear, elbow straight. And this twisting is like an internal massage for your kidneys. And breathe in and out. And it's time to meditate. The tiger is associated with the element metal and the organ of the lungs. Breathe in, breathe out. Breathe in, bring in the left foot and make your hands like claws. Step out with the left foot and exhale, push out. Turn the wrists, bring them back, stretch back, turn the wrists, breathe in, exhale, turn the wrists, inhale, exhale, inhale, push out, exhale, inhale, exhale, and collect the chi and bring it to your lower dantian and meditate. The leopard is associated with the element of wood and of the liver. Breathe in, arms up. Breathe out, arms down. Breathe in, left on the bottom and right arm on the top. Step out with the left foot. Stretch over like a cat with your left arm underneath your armpit. And bring the arms down. Collect the chi. And take a moment to allow your heart rate to slow and your breathing to become more normal. And inhale, arms up. Exhale. And left arm on top, right arm on the bottom, like you're holding a ball. Step out with the right foot. Stretch over with the left arm. Right arm is underneath the armpit. And collect the chi. And meditate. The snake is associated with the element of earth and the spleen. Raise your hands, inhale, lower them, exhale. Raise the hands, inhale, bring the arms to the side. Put your left hand over your right palm up and then turn the palm to palm down. Bring the right arm down and as if it is a snake, then bring the left arm up, Hold that position and go down like a snake and collect the chi. Take a moment to allow your heart rate to slow and your breathing to become normal. And raise the palms, inhale, lower them, exhale. And inhale, bring the arms to the side, turn to the right. Bring the right arm over the left with palm up, and as you pass over the hand, it goes palm down. Left arm goes down like a snake. Right arm goes up. Hold the position. And right arm goes down like a snake. Collect the chi and meditate. The crane is associated with the element fire and the organ, the heart. Lift the left leg to the front. Circle it around. If you can, lean forward slightly. And bring the leg back around to the front and down. I've turned to the side so you can see this more easily. And now for the other side. Raise the arms, inhale. Lower the arms, exhale. Breathe in, bring the arms to the side. Now lift the right leg. And take it around. If you can, lean slightly forward. Bring the leg back around. And down. Collect the chi. Collect the chi. Breathe in, breathe out. One more time, breathe in, breathe out. Place your hands on your lower dantian, rub one direction 3 times, And the other direction 3 times. Rub your hands together to create some heat. Then place the lower part of your palms gently on your eyes and breathe in. Dry wash your face. And rub your hands together. And gently place on your eyes and breathe in. Dry wash your face. At the end of your practice or rehearsal session, it's important to cool down. While still on the instrument, play very short, slow, and soft repetitions of your previous sprint excerpts with a play-to-rest ratio of 1:4. This should be done for at least 10 minutes. Then off the instruments, we will do a variety of stretches and massage and tension releasing. To begin, stretch from the top of your body down, starting with your neck. Bend forward and back and side to side. Lightly pull the arm upward. Bring the arms forward, palms up. Bring the hands up and fold it back. Put the palms down, point the fingers to the ground, then up to the sky. Put your hand crossing over to your shoulder, then press against the elbow. Now the other side. Now let's begin your self-massage. Let's begin with a brocade massage. Place your hands in the middle of your back. Then press down over the kidneys, then all the way down the sides of each leg to the top of the feet. Then come up the inside of the leg. Roll up slowly with each part of the vertebrae. Do this 3 times. Shoulder shrugging massage. Roll your shoulder forward. Grab it with your other hand, and while holding the shoulder, roll it to the back. Do this 3 times on each shoulder. Here's number 2, number 3. Now the other side. 1 and 2 and 3. Knuckles to the neck massage. Place the knuckles of your hands on either side of your cervical spine and massage in a circular motion. Long traction of the neck. Place your hands on your shoulders and draw each hand with pressure across the neck and up to the scalp. Do this 3 times. Here's number 2 and number 3. iron shirt. Pound the muscles of your arms and shoulders lightly with your fist. Go up to your shoulder and then back down to your hand 3 times. 2 and 3. Now the other side. 1, 2, and 3. Light joint mobilization. Roll the joint with your hand and then massage pressure points above and below each joint. Do this at the elbow as well, and for each joint in the fingers and hand. Now the other side, shoulder, elbow, wrist, and hand. Skin rolling. Roll the skin up and down the arm and hands from side to side. Now the other arm. Long traction of the arms and hands. Gently pull along the arm all the way to the fingertips. And now the other side. Tension releasing. First, shake like a dog. Allow your arms and hands to hang and swing freely. Now switch to twisting at the waist and continue to allow your arms to hang freely. Tension drop. Breathe in, pull your arms behind you, and then drop your tension into the floor. And again, breathe and drop your tension into the floor. Last time, breathe and drop your tension into the floor. Put your palms together and create friction by rubbing them together. Now place the heel of the palm gently on your closed eyes and breathe in deeply. Dry wash your face. Bring the arms and hands to a meditation position. Think about your rehearsal or practice session. Think about the positive things that you did and what you might work on the next time. Now, collect the chi 3 times. Arms up to the sides, breathe in, and exhale as the arms go down. Breathe in, arms up, and out as the arms go down. Last time, breathe in, and arms down. Once again, rub your palms together to create friction, and place them gently over your eyes, and dry wash your face. I hope this cool down has been helpful to you. Finally, let's take a moment to self-reflect. Of the exercise interventions presented, which might best meet the needs of your students and your own musculoskeletal needs? How might you modify an exercise intervention presented here to match your own circumstances in your classroom?
For more information, please reach out to us by email at wudongwellness@gmail.com.